And later for you all this hour, really a stunning story. The death of a decorated U.S. Olympian during childbirth is shining a light on the startling difference in maternal mortality rates for women of color. We'll be joined by a doctor to take a look at the root causes of this, as well as potential solutions.
An autopsy report shows U.S. Olympic champion sprinter Tori Bowie died from complications of childbirth. Last month, officials found the 32-year-old dead in her home after conducting a well-being check. CBS News correspondent Elise Preston spoke with her agent, Kimberly Holland. She says while Bowie did not actively intend to perform a home birth, she also had hesitations about delivering in a hospital.
She didn't trust the hospitals. She wanted to make sure that the baby was going to be okay with her being in control.
Well, joining us now is Dr. Nicole Williams. She's the founder of the Gynecology Institute of Chicago. Dr. Williams, thanks for being here. We heard how Bowie was worried about receiving care at a hospital. When you hear this story, tell us, what is your concern?
You know, Lana, unfortunately, I hear this concern many, many times with my own patients. Just recently, I diagnosed a patient with her first pregnancy, and she looked at me and with fear, am I going to be okay? That was the question she had for me, because when African-American women are in the hospital, all too often our concerns are not validated. Certain things like if you have a headache, if you have very severe nausea and vomiting, if you have pain in your upper belly, these can be signs of a condition called preeclampsia, very severe preeclampsia, which could indicate the possibility of seizure, coma, loss of the pregnancy, and unfortunately, in Ms. Bowie's case, the loss of her own life.
Yeah, I want to talk to you more about preeclampsia, but let's stay with this point about childbirth and mortality rates. Black women are 3 times more likely than white women to die from a pregnancy-related cause. I'm wondering both, why is there such a discrepancy, and based off of both what you and Bowie was saying, Bowie's agent was saying, is it better to try and pursue home births, or is it better still in these cases to be in a hospital?
Well, the American College of OBGYNs, of which I am a member, we still believe and we know that doing a delivery in the hospital is still the safest way to bring your new baby into this world. What we also do recommend is that you have a neutral party in the room, such as a doula or some other family member who is not your direct partner, in order to advocate for you on your behalf. So if you feel as if something is wrong, then that person can be a neutral party in the room, communicate with the hospital staff, and then make sure that you get the care you need.
Advocacy is so important whenever somebody's in the hospital. As promised, I want to get back to this point because Bowie's autopsy report cited eclampsia as a potential complication. Not many people are familiar with this dangerous condition. Talk to us, give us the opportunity to learn from this tragedy. Tell us about it and how pregnant women can prevent it.
It's important that we understand and are more aware of this particular condition, because even though it's only about 3%, it can kill, of course, as it did in Ms. Bowie's case. So the things you're going to want to look for, and whenever you go in for your prenatal visits, we do 2 things that are very, very important. We check your blood pressure and we check your urine for protein. Now, the graphic shows that we're talking about eclampsia here. That is seizures during pregnancy. And like we said, just 3% of people with preeclampsia. So rare, but it can be fatal for mother and baby. So things you're going to want to look for: headache, blurry vision, and even mental status changes, meaning if you just don't feel quite right. And this is why you need an advocate in your room. And then we see the graphic here, swelling in the face as well. And again, mental health changes. And that's really, really important, especially for people around you to know and notice that if your behavior is changing, this could actually be a sign of severe preeclampsia and you need to get to the hospital.
Really appreciate you being with us. Dr. Nicole Williams, thank you.
My pleasure. Thank you.